This lecture is based on work health and safety. We'll be looking at how you can keep yourself safe in the dangerous environments that nurses work in. Keeping yourself safe needs to be your first priority when you're going to work, so this lecture is important in understanding what your rights and responsibilities are as an employee. This lecture is based on work health and safety. We'll be looking at what actually is work health and safety, employers' responsibilities, employees' responsibilities, identification of hazards, the most common hazards that nurses experience, and hazard minimisation. If you have a look at the picture on the right, this is perhaps the most important part of work health and safety. It's ultimately all about nurses returning home safely from work to their families. What is work health and safety? Perhaps the best place to find a definition for this term would be the legislation that governs it. While we will be looking at the New South Wales legislation across states and territories are drafted from the same document, so they all look very similar. Work Health Safety Act of New South Wales 2011 states that work health and safety is protecting workers and other persons against harm to their health, safety and welfare through the elimination or minimisation of risks arising from work, and also providing for fair and effective workplace representation, consultation, cooperation and issue resolution in relation to work health and safety. Work health and safety in New South Wales is governed by the following documents. The Work Health Safety Act of 2011 is the main law that people must abide by. Work Health Safety Regulation of 2011 spells this out in more details. While New South Wales codes of practice go even further into detail, for example, managing the risk of falls in the workplace is a specific code of practice. We also have Safe Work New South Wales, which is the regulator of these acts. We have Work Cover of New South Wales, and finally we have the Nursing and Midwifery Board of Australia. While the next few slides include quite a bit of text, it's important to pause this video and read them in detail. If you are hurt while at work, or there is a hazard that your employer is refusing to act on, it is this legislation that is designed to protect you and force your employer to take appropriate action. According to this legislation, your employer is a person conducting a business or undertaking and states that this person must ensure your safety as far as reasonably practicable. The concept of what is reasonably practicable is something that we'll discuss in more detail. Workers are described as anyone engaged by the person as part of the business or undertaking. The employer also has a responsibility not to put you at risk of harm in the conduct of your work. The employer must provide a safe workplace, correct and well-maintained equipment, correctly stored substances and equipment and adequate facilities for the welfare of the workers. The employer must also provide adequate training and supervision to keep you safe, and they must also monitor the health of workers and the conditions that they're working in. As a worker, you have a legal right to demand your employer is meeting these obligations. Now that we've looked at what you should expect from your employer, let's look at what your employer should expect from you. As a worker, you must take reasonable care for your own health and safety, ensure your actions or inactions do not cause harm to others, and you must comply with instructions given by your employer, as well as policies or procedures. As a registered nurse, you're also governed by the Registered Nurse Standards for Practice. The following standards are relevant to work health safety. You must actively foster a culture of safety, including how you engage with health professionals and others. You must accept accountability for your own decisions, actions and responsibilities, as well as the people that you're responsible for. A good example of this is the duty of care that you'll have for undergraduate students on clinical placement. You are accountable for keeping them safe, and to a large extent you are accountable for their actions. Standard 6 also includes the responsibilities to provide safe care, to provide effective and timely direction and supervision to those who report to you, to practice in accordance with all policies and legislation, and also to identify and report potential or actual risks or behaviours. This legislation can really be simplified to two statements. It is really a contract between you and your employer. So what are these two statements? Your employer has a legal responsibility to ensure that you have a safe work environment. You have a legal responsibility to work safely and comply with all reasonable efforts to ensure workplace is safe. What are hazards, risks, and risk controls? A hazard means a situation or thing that has the potential to harm a person. Hazards at work might include noisy machinery, a moving forklift, chemicals, electricity, working at heights, a repetitive job, or bullying and violence at the workplace. A risk is the possibility that harm, death, injury, or illness might occur when exposed to a hazard. Risk control means taking action to eliminate health and safety risks so far as reasonably practicable. And if this isn't possible, minimising the risks so far as reasonably practicable. Eliminating a hazard will also eliminate any risks associated with that hazard. Many hazards can be rectified, at least temporarily, by the person who finds it. Take the time, even if you're busy, to make sure someone doesn't get hurt. Mop the spill, tag the equipment, safely dispose of the sharp. Communicate with everyone working in the area so they aren't harmed by the same thing. Make sure the person in charge, which is typically the NUM or nurse manager, is aware and understands the hazard. Also use signs and tags to make sure that the equipment has been labelled. Risk is assessed by considering two factors. How bad is it if it happens, and how often or how likely is it to happen? When we look at the box here, we can see if something's very rarely likely to happen and it only has minor injuries, then it has a low risk. Whereas something that causes fatalities and is very likely to occur has a very high risk. This is really important to consider when we look at whether we're going to be able to eliminate or control the risk, which we'll look at shortly. Common hazards to nurses include musculoskeletal, sprains and strains, lifting, pushing and pulling, repetitive stress, falls, being hit or cut by an object, or exposure to mental stress. These were the highest ranking hazards that caused harm to nurses as according to Safe Work Australia. One of the most common hazards that nurses experience are manual handling issues. This is from moving patients in bed or transferring patients from bed to bed or bed to chair or chair to bed. The most common injuries include back injuries, shoulder injuries and knee injuries. So what is manual handling and why is it so harmful to nurses? The term manual handling applies to any activity that requires the use of force exerted by a person to lift, lower, push, pull, carry or otherwise move, hold or restrain any object or person. Obviously this term can cover a lot of different things in a lot of different jobs. So why is manual handling specifically harmful to nurses? The most common task that nurses generally perform is moving people, which is the load that we're moving. This poses specific manual handling risks. Let's consider the patient that we're moving as a load. This load has no handles. The load may be very heavy. Some patients weigh more than 200 kilograms. The load may be unpredictable, uncooperative, and sometimes even combative. The load is very important. We cannot afford to drop it, and often very fragile. The load may be in an impractical location, difficult to access. For instance, if someone falls off the side of a bed, they may be difficult to get to. And the load may have several attachments, such as catheters, drains and intravenous lines. It's these factors that make manual handling for nurses much more dangerous. Most organisations have a no lift or low lift policy. This means that no one is allowed to lift people and try to move them. So we assist the patient to move themselves rather than moving the patient. We use the bed mechanics to move the bed up and down to help us and help the person move themselves, and we also use correct lifting devices. In these pictures we can see two examples of a lifting device that's used to help move a person. You can see a lifter, also referred to as a hoist, and you can see on the right a stand-up lifter, also referred to as a Sarah Steady. These devices are used to move the patient, and you can see that only one nurse is required to move the person. There is no lifting involved in using these devices. They are particularly underused in many facilities because they take a little bit of extra time to set up. However, nurses are required to use equipment, as we've discussed, legally, so it's important that you know the correct lifting devices, that you have them available in your workplace, and that you use them properly. Other devices used to move people include slide sheets on the left, which reduce the resistance in between the person and the bed so they can be moved much more easily, and a walking belt on the right, also called a Johnny belt. These allow the person helping the patient move around to provide support so that they have handles, helps us move the load. Also, when considering manual handling, whenever we're carrying other loads such as equipment or restocking items, it's important that you hold the load close to your body. You can see from this picture that the further away the person holds, the much more pressure they put on their lower back. It's really important to carry heavy items at waist height and not to lean forward like that. Another common hazard to nurses is sharps. Sharps include needles, cannulas, suture cutters, scalpels, glass ampules, the spikes put into IV bags, and also guide wires. Whenever you have a sharp in your hand, you should also be within distance of a safe disposal container that you can use to dispose of it immediately. A sharp is the responsibility of the person that uses it. Be wary of colleagues that have not disposed of sharps correctly, cannulas, scalpels example. Never resheathe a needle, and never put a sharp anywhere other than directly into a sharps bin. On this slide we can see a small sharps container, referred to as a point of use container, because you take it with you as you go to use a sharp. The larger container is typically found in high use areas such as treatment rooms and critical care departments. Another hazard to the health of a nurse is infection. We wear infection control PPE, including contact precautions, droplet precautions, or airborne precautions. And of course, we must remember hand hygiene. This protects us from catching infections. While we have reviewed this in our infection control topic, it's important to reflect on infection control as a method of minimising risk. We wear PPE to prevent contaminating one patient with the microorganisms from another patient, but we also wear PPE to protect ourselves. Remember that we also have portals of entry, so we wear these types of protection to cover them. Nurses often become complacent about PPE, but you need to remember, would I want to give this infection to my family? Unfortunately, one of the most significant threats to a nurse's safety is aggressive behaviour. This can be from patients, their family, or other visitors, but it can also be from co-workers. In many cases of aggression, the person is confused or delirious as part of their illness or being away from their normal environment. People also get frustrated with waiting long periods or not knowing what's going on with them. Also, patients may be under the influence of alcohol or other substances. So what can we do about this hazard? It's important to remember that people in a healthcare setting are often under a lot of stress. People get angry, often due to long waiting periods, not knowing what's going on, or they're experiencing symptoms like pain or nausea. While we do not tolerate aggressive behaviour, we need to be mindful of what might be causing this person to be aggressive and what we might be able to do to address this stress for them. We can use de-escalation techniques, duress alarms. You should seek help. You never manage an aggressive situation by yourself. You might consider counselling or debriefing, and you make sure your department has a plan to manage aggressive people. According to Australian Nursing and Midwifery Federation, bullying is unreasonable behaviour directed towards an employee or group of employees that creates a risk to the psychological or physical health or safety of employees. Bullying can occur by a single person or by a group of people. It can be direct or indirect, physical or psychological, and it need not be intentional. Effects of bullying include physical and psychological symptoms. Direct forms of bullying may include abusive, insulting comments or offensive language, which includes face-to-face, phone, email, text messages, and social media. Humiliating or putting someone down in front of others, or spreading malicious rumours or misinformation about someone. Examples of indirect bullying include changing work or leave rosters to deliberately inconvenience a particular employee, deliberately excluding someone from workplace activities, excessive scrutiny at work, unjustified criticism or complaints, setting unreasonable timelines or constantly changing deadlines, setting tasks that are unreasonably above and beyond a person's skill level, or withholding information that is vital for effective work performance. Sometimes people believe they're being bullied when they're actually not. A single incident of negative behaviour is not considered to be workplace bullying. However, it may have the potential to escalate, and so it should not be ignored. It should still be reported. Low-level workplace conflict is not workplace bullying because not all conflicts or disagreements have negative health effects or pose a risk to health and safety. If low-level conflict is not managed properly, it can escalate to the point where it does meet the definition of workplace bullying. Reasonable management actions, including performance management, is not considered bullying. Your manager has a right and a responsibility to manage your performance if you're not meeting expectations. So what should you do if you believe you've been the victim of bullying? Firstly, don't pretend it isn't happening. Hoping a bully will leave you alone simply doesn't work. You need evidence. Write a diary of dates and times, witnesses, exact comments or actions that you feel were not appropriate. Report to your manager. You should expect a result from this. Remember that your employer has a responsibility to ensure a safe workplace. You should escalate up to the executive chain if the manager's response is not sufficient, or you should consider seeking help from the ANMF, your Work Health Safety Committee member, or a union representative, even if you're not a union member. Another significant hazard for nurses includes fatigue. Nurses often work overtime, and they have an increased error rate, including needle stick injuries when they're tired. Sometimes they have short breaks in between shifts. Sometimes they work long hours. Some nurses work 12-hour shifts instead of 8-hour shifts. And also a long travel to and from work can increase your fatigue. So how can we reduce hazards? This is the hierarchy of control. Ultimately, the best way to control a hazard is to eliminate it. We can physically remove the hazard in some situations. If we can't do this, we might be able to replace the hazard. We might be able to isolate people away from the hazard. We might change the way people do their work, or we might protect the worker with personal protection equipment. Ideally, all hazards would be completely eliminated, but this is not always possible. The most obvious example is that patients have inherent risks that they cause to nurses anyway, and we can't get rid of patients. So we look at what we might be able to do to eliminate the hazard where we can. To start off with, elimination. We could move a noisy piece of equipment away from populated areas. If we can't do that, we might be able to use substitution. For instance, we could use a different brand of needle with a sharp, safe device, because we can't eliminate the use of needles altogether, but we can use a different type of needle that's safer to use. If we can't substitute it, we might be able to use engineering. For instance, if we include duress alarms for nurses to press when someone's being aggressive in their workplace, this might reduce the risk of them being harmed. If we can't use engineering, we are left with administration. We can write a procedure that health workers follow to ensure the procedure exposes minimum risk. And also, we can use PPE. When we can't do anything to eliminate the risk above, then we simply need to provide safety glasses to healthcare workers when splash hazard is likely, because we can't do any more than that to reduce the risk of splash hazard. So what should you do if your boss or your employer isn't listening to you? You should perform a hazard assessment to consider the risk involved. You should report the hazard following organisational guidelines. For New South Wales Health, that would be an IMS. You should send your manager an email as well as speaking to them in person. You should escalate through the management structure if you don't get resolution with your manager. You should also report to your Work Health and Safety Committee, and you should report to the state regulator. For New South Wales, that would be Safe Work New South Wales. In conclusion of this lecture, your employer has a responsibility to provide a safe workspace for you to work in. If this is not occurring, report it and escalate if needed. You have a responsibility to perform your work in a safe manner, using the correct processes and the correct equipment. You only have one back, so look after it. Don't let other people convince you to adopt practices that may increase the risk of you getting hurt. And nothing, time, cost, laziness, or not wanting to offend anyone, should be more important than making sure that everyone goes home safely to their families. This is the end of this lecture. There will be some information on the Interact website about this topic, and we'll also be going through lots of work health safety stuff in the labs.